A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant move that has stirred the political waters, President-elect Donald Trump has appointed Dr. Bhattacharya, a health economist and vocal critic of pandemic lockdowns and vaccine mandates, to lead the National Institutes of Health, NIH. This appointment comes as part of Trump's broader strategy to reshape health policy in the United States, particularly in the wake of the COVID-19 pandemic. Dr. Bhattacharya, a 56-year-old physician and professor at Stanford University School of Medicine, has been a controversial figure in the public health community. He was one of the three authors of the Great Barrington Declaration, an October 2020 open letter that argued against lockdowns, claiming they were causing significant harm to public health and the economy. The declaration advocated for a focus on herd immunity, suggesting that individuals at low risk for COVID-19 should be allowed to live normally while protecting those at higher risk. In a statement released on Tuesday evening, Trump expressed his confidence in Bhattacharya's ability to lead the NIH and collaborate with Robert F. Kennedy Jr., whom he has nominated to head the Department of Health and Human Services. Trump stated, "Together, J and RFK Jr. will restore the NIH to a gold standard of medical research as they examine the underlying causes of and solutions to America's biggest health challenges, including our crisis of chronic illness and disease." The selection of Bhattacharya underscores the ongoing influence of the COVID-19 pandemic on the political landscape surrounding public health. His stance against lockdowns and vaccine mandates has garnered both support and criticism. While some view him as a champion of personal freedoms and a necessary voice in the public health debate, others label his views as dangerous and contrary to established scientific consensus. During a panel discussion in March 2021, Bhattacharya stated, "I think the lockdowns were the single biggest public health mistake." This sentiment resonates with a faction of the population that has grown weary of pandemic restrictions and mandates. However, it has also drawn ire from many public health experts who argue that such measures were essential in controlling the spread of the virus. The Great Barrington Declaration, which Bhattacharya co-authored, has been a point of contention in the public health discourse. While it found some support within the Trump administration, it was met with widespread condemnation from public health officials, including former NIH Director Dr. Francis Collins, who described it as dangerous and not reflective of mainstream science. As Bhattacharya prepares to take on his new role, he faces the challenge of uniting a divided public health community and addressing the myriad health issues facing the nation. The NIH, with its $48 billion budget, plays a crucial role in funding medical research on vaccines, cancer, and various diseases through competitive grants to researchers across the country. It also conducts its own research with thousands of scientists working in its labs in Bethesda, Maryland. In addition to Bhattacharya's appointment, Trump announced that Jim O'Neill, a former HHS official, would serve as Deputy Secretary of the NIH. O'Neill's experience inside the bureaucracy is seen as a potential asset in navigating the complexities of the agency. Trump's health picks, including Bhattacharya and Kennedy, represent a departure from traditional public health leadership. They are Washington outsiders who promise to shake up the agencies and bring new perspectives to long-standing health issues. This approach aligns with Trump's broader populist agenda, appealing to voters who feel disillusioned with the established political and health systems. Bhattacharya's views on vaccine mandates have also sparked debate. He has argued that such mandates erode public trust in the health system, a sentiment that resonates with many who oppose government overreach in personal health decisions. His recent legal battles, including being a plaintiff in a Supreme Court case regarding the suppression of conservative views on social media, highlight the contentious nature of the current public health discourse. As the new administration takes shape, the implications of Bhattacharya's leadership at the NIH will likely reverberate across the medical research community and the broader public health landscape. The agency's mission to support vital research and innovation in healthcare will be scrutinized as it navigates the challenges posed by a polarized political environment. In conclusion, Dr. Bhattacharya's appointment as the head of the National Institutes of Health marks a pivotal moment in the intersection of politics and public health. With the ongoing fallout from the COVID-19 pandemic still fresh in the minds of many Americans, his leadership will be critical in shaping the future of health policy and research in the country. As the nation grapples with chronic illness and disease, The effectiveness of the NIH under Bhattacharya's direction will be observed closely by both supporters and critics alike. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.